Yes, it's been 14 years since I was told that I was going to die, and I was at Johns Hopkins Hospital, and they told me to go home to hospice. And I kept on telling them I was not going to die. They didn't believe me, but I probably would have if I had not had the opportunity to meet Warren Ross, my physician, who saved my life. And without further ado, let me introduce you to Dr. Ross, who I hold in the highest of esteem. Welcome to our show.
Thank you. Thank you very much.
You're welcome. Dr. Ross, can you tell our viewers a little bit about you and your practice and your integrated health practice, please?
Well, we're one of the, I think, the only practices in the region, and maybe even in the country, that practices regular conventional medicine, participates with insurance, sees adult patients of all ages, but also tries to integrate complementary alternative strategies in trying to optimize people's health. So we work with diet and nutrition, with supplement programs, herbal programs, physically oriented programs to strengthen people or improve their, reduce fragility, particularly in the elderly, bioenergetic programs like acupuncture, and what I call self-regulation programs, which really help people to deal with stress and to have an option to only medication. And the reason I like the last program, the self-regulation program, is that it's empowering. We teach the people skills that they can use and practice at home, etc. So
that's really wonderful.
That's really been exciting for us. We've tried to do it within the context of what insurance will pay, so people can afford it. And it's an ongoing process. We're getting better at it.
That surely makes a difference. My goodness gracious. Can you give us some examples of some of the therapies that you do? I guess if a person has anxiety or stomach problems, so just a variety of things
with
you do.
The anxiety disorders, we're using the self-regulation therapies among other strategies. But those therapies, one of them is called Open Focus, and Open Focus was developed by a psychologist named Les Fehmi starting in the 60s, and it teaches people attentional flexibility. Our attention we attend to details, or we attend in a broad way, but our attention is what gives us information about the world.
Yes.
When our focus is closed, we tend to, that's the way we learn to solve problems. And everyone's taught from a young age, even with babies, to focus on their mom's face, etc.
Yes.
But if there's attentional rigidity, and all you can do is do closed focus, you develop the problems of modern life, the stress responses, the headaches, the psychological fatigue, even the muscle tension and physical fatigue. So attentional flexibility teaches people that there's more than one way to attend to their thoughts, to their inner environment and outer environment. And the teaching involves information sharing, practices which they do with us, but also take home, and then EEG biofeedback. And this EEG biofeedback is unique in that it teaches brain synchrony. When the left and the right, or the right and the left, lobes are producing the same rhythms, you're in brain synchrony. And when you're in brain synchrony, you're in open focus. And when you're in open focus, your body can't be stressed. That is the state in which information is integrated and processed. That is the state in which sort of brain reorganization and healing takes place. And so the home practice accomplishes this, but the EEG biofeedback actually confirms that people are achieving what it is that we're talking about.
Is it a very long process?
The practice, the way we're going to structure this is we're going to do twice a month group sessions.
Very nice.
And then weekly individual practice where they get to do the EEG biofeedback. But the individual has to practice at home.
Of course, yes.
And it's a lifelong practice of, it's a form of, you could say it's a form of meditation, but the exercises are having a person sit quietly and consider space and volume. Because visually, when you consider space, you can't be focused, and the dominant attentional form for us is vision. There's auditory forms, there's feeling forms,
Yes.
there's taste, there's smell, there's thoughts. We can focus on our thoughts. And when we over-focus on our thoughts, those are repetitive, obsessive thoughts,
Yes,
we get stressed.
absolutely.
This teaches people to break that pattern and can even be applied to chronic pain.
Oh, is that something?
Yeah, and the reason is that acute pain is typically initiated by a trauma to some peripheral tissue. But the pain is processed centrally. It's processed in the spinal cord and the brain. That central processing can become disrupted, so the feelings of discomfort become exaggerated.
Okay.
This teaches people, again, not to focus on those feelings, and so that they gently, let's say, put into perspective those feelings in a much broader palette of, of attention.
Well, it seems like this really could help so many different people.
Yeah, and we're having a great deal of, I'm excited because it's a tool that empowers people, and I think it'll be very effective.
Well, you know, so many people are so focused on making themselves live a longer life, a healthier life. What other types of things can you offer in the practice for people to come to you?
Well, we have wonderful diet counselors who can work with people to optimize their diet based upon their own unique needs and vulnerabilities. So people who have difficulty with blood pressure control might need to go in a certain direction, and a certain subgroup of such people, if they reduce salt intake, can
Right.
reduce their blood pressure without meds. Other people have trouble with blood sugar metabolism. Other people have irritable bowel syndrome, etc.
Really?
And they can explore in time strategies to make changes in their lifestyle that reduce those symptoms. We have a woman who's an herbalist and has done wonderful work with people with PMS and fertility issues, etc.
So you really can help really any man or woman.
Because we're
With
not
any
treating the
problems.
foreground event of the disease or the worry, but the background substrate of the person's health upon which those diseases arise.
Have you had anybody, aside from myself, where they were told there's nothing you could do about it, and you've helped them make themselves healthier and improve their life?
I have, but I always ascribe it as much to good luck as to skill.
Oh, you are one of the most knowledgeable people that I have ever met in my life. It's knowledge. It is. So, you know, so really anybody could come to you for their annual checkup, but then they could also come to you for just a better life overall.
That's correct. And there's a variety of options they can choose to work on.
Now, there was something you were telling me. I have a child with autism, as you know, and a lot of people have, we were talking about anxiety, but people have aggressive behavior. Some people have ADHD. Are there any other types of, and some people just want to have an overall better health. There was something that you told me that you all are doing.
Well, we do neurofeedback training, which is, again, there's many ways to look at the autism spectrum disorder, but it is a processing and attentional disorder. Because for a lot of these children, there is a very, very tight and closed focus. That is, a lot of their energy is spent keeping stimuli away, and so it doesn't affect them and irritate them. And the energy that takes limits the world they experience.
It surely does.
So as you teach them to broaden their focus, they can relax with these stimuli. They're not so negatively impactful, and they generally do a much better job, or
So-
they feel better in their world.
Yes. So what other types of things would you like to share with our audience to inspire them to come to you? Because personally, I would not consider going anyplace else to have my health care. You've
Well,
just
that's
been
very
amazing
nice.
to my family.
The programs we have are broad. We do open houses from time to time. We haven't done one this quarter of the year, but we'll do one probably in February of next year, and that's when we'll go over the new developments
Very
that
good.
I think will be exciting for people.
Is there a website that you can share with everyone?
Well, it's constantly changing, but Warren Ross MD is the website.
Okay.
And they can get a lot of information.
And a
from
phone
me.
number for them?
410-997-5191.
I know it by heart. I do. And you're on Dorsey Hall Road, over in Ellicott City.
Right.
Very easy to get to, and I encourage people to turn to you. They'll have a healthier and happier life. I know I do.
Thank you very much.
Well, thank you. And my whole family thanks you for saving my life on most days. And thanks. I hope you'll come back again and tell us about some more of your services you could offer patients to have a better life.
Okay, I will.
Thanks, Dr. S. Stay with us. We'll be right back. So